Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the co-founder and CEO of Nomad Health, Alexi Nazem. How are you today?
I'm great. Thank you, Jared. Thanks for inviting me.
Excited to have you here. Let's dive right in. Tell the audience a little bit about yourself, and then we'll talk a little bit about Nomad Health.
Sure. So I am a native New Yorker. I'm still here, and grew up in the city. Grew up in a family very much in the medical world. Became a doctor. Was involved also in a lot of sort of non-clinical parts of healthcare. Was engaged in healthcare systems improvement at the very beginning of my career, and then over time got very interested in sort of the way that you could use technology and outside in creative destruction through startup type companies to make improvements in the healthcare system. And my desire to do that became even greater when I was a practicing physician, because I would see every day all the things that weren't working so well. So I wanted to be able to fix some of those problems, and then got involved more and more and more, to the point where I decided to stop being a practicing doctor and start being a startup entrepreneur. And that was about 7, 8 years ago when I co-founded this company, Nomad.
And what was that transition like? I know that jump is something I hear a lot of, practicing clinicians that want to make that jump. How how difficult was it in the early days, and then how did you get more comfortable, I guess, with transitioning to that, that entrepreneurial, that leadership role?
I mean, of course, it's very different. Medicine is all about routines and perfectly executing the same things over and over and over again. And being an entrepreneur is the exact opposite of that. It's failing forward, learning from mistakes and then not doing them again. And so it's like a very structurally different kind of environment. But what was helpful was that the thing that I was the things that I was getting to work on in startup land were problems that I encountered as a professional, and so there was a great degree of familiarity and commonality that I could rely upon to sort of be a foundation. And then, of course, I was very lucky to have a lot of great people around me to learn from. So my co-founders, investors, friends and family that I've obviously built up over many, many, many years, and so luckily, was supported, so I didn't fall down on my face too much. But yeah, I mean, it was a difficult transition, but honestly, one that I was very excited about, and I think that excitement powers you through a lot of the challenges. It's one of the best things about being an entrepreneur. The optimism that's associated with it, and optimism is it's like a superpower.
Yeah, when I was actually talking with someone the other day, also, which sounds weird, right? Also, you have to, in an entrepreneurial position, you have to get used to being kicked a lot, as well as being optimistic and having the highs. So it's that's probably in the early days the most difficult part, right? Of you're going to have some interesting some interesting days as
Yeah.
well, and have to push through it. But well, talk me through, Alexi. Give us the overview of where Nomad Health is today.
Sure. So Nomad is a marketplace for short-term staffing in healthcare. We help health systems and other organizations fill roles for nurses and a variety of allied health professionals like ultrasound technologists and scrub techs and people like that. And what we've done is create an online, transparent, self-service marketplace to connect these two sides, ensure that they are matched to each other properly, that the clinicians are qualified for the positions. We do it as I said, an online, transparent fashion, and using a lot of also technology-driven automation, which makes things a lot more efficient, more quick, and so the value proposition to all parties involved is not only that you're directly engaging with the counterparty, but also that it's all a much better economic bargain because we're much more efficient as a company. We don't need to take out as much commission from these transactions as a traditional people-powered agency would have to. And so that means that our clinicians get paid more and our health systems pay less for the exact same service. And so that's better experience, better price. Generally a good value proposition. So that's what we've been working on for the last almost 8 years. And the business has grown tremendously from very humble beginnings, and now still a long way to go. But I think making a meaningful impact on our customers, on our clinicians, and certainly just on the world of healthcare staffing more generally. I think we're one of the first technology companies in the space, and now the world of healthcare staffing is definitely moving in our direction. So it's been an interesting 8 years for
Yeah,
sure.
because in the past you have these large healthcare staffing companies that were charging top dollar because they could, right? Because there weren't the technology solutions like what you've built at Nomad Health that can help that. And also that was resulting, like you said, in the providers not getting maybe as much as they could, because part of it was going to the staffing companies, and then the
Mhm.
other part was being tacked on to what the organizations were paying.
But to be clear, I mean, I think that it wasn't a question of greed. I think it was just a question of necessity because of the inherent inefficiencies of people powered businesses. I don't think that healthcare staffing firms are excessively charging. It's just the in order for them to deliver the service in a reliable fashion and to earn a decent, not outrageous, but a decent profit. It's just that's what the things cost, and so um, we're trying to offer a better bargain, but because we're getting to leverage things that didn't exist 50 years ago when this whole market got started.
One of the big differences, though, you adapted to where the market is heading, and some have not, right? From outsider looking
Yeah,
in. So kudos to you and your team for that. And
thank you.
and one of the big issues you're helping to address, right, is we all hear about these across the board, right, but specifically in like the nursing and allied health space, these massive staffing shortages that have just continued to grow and over time. So
Mhm.
talk me through Nomad's role in helping to kind of mitigate this shortage through what you're doing.
You're absolutely right that the shortage is large and growing. It's mostly driven by demographics. The aging population is using more and more healthcare, but the supply of clinicians to provide that care is not keeping pace with that growth in demand. And so you're seeing this widening gap between supply and demand. And the way that you can fill it, pretty much the only way you can fill it, is with short term fractional coverage. And so that's what the healthcare staffing industry is all about, and Nomad is part of that. Obviously, you can't solve 100% of that shortage with a better allocation of resources, but I think that there is a lot of the gap that can be closed through much more efficient allocation of those resources, and also um, exercising more of the latent capacity in the system. And so the way that Nomad is helping with that is multifold. Number one is that we make the whole process just more efficient and lower cost, so that you can actually tolerate using more temporary staff to meet needs, and more reliably too is the other important thing. So it becomes possible to leverage more temporary staff, which is a necessary thing if you want to actually close the gap. Uh, and then the other way that we help with this is that by lowering the barrier to entry, especially on the clinical side, the clinician side, you can mobilize more of that supply. That's again part of the exercising the latent capacity. So for people who might not have otherwise participated in the healthcare staffing realm as let's say a traveling nurse, because it would have been too much of a headache to go through all that paperwork and phone calls and faxes and stuff like that. Now, when you can do it all on your phone very quickly in a matter of minutes, okay, maybe there's actually kind of something interesting to me, and I'll do it. That's a big part of the way that we're helping to mitigate the shortage. But like I said, I think it's very important to understand that no amount of staffing is going to solve the underlying staffing crisis, but I think that we can substantially blunt the impact.
And one of the big things, right, when building out these marketplaces, a common objection that people will hear or just questioning will be, how do you ensure quality, right? So talk me through how Nomad Health manages for quality.
That is something that we obsess about. First of all, my whole career started in quality and quality improvement and healthcare, and so um, being being interested in the reliable application of best practices and high quality clinical processes is something that is in my bones, and it's something that from the first day we started this company, we were very focused on ensuring. Trust is something that you must build into marketplaces for them to be successful. And by the way, it's just the right thing to do for healthcare. This is a very important job. We're putting people at the bedside of patients who need them, and so you want to make sure that that person is perfectly qualified for the position. And the benefit actually of running a technology driven company is that you have the ability to strictly enforce a very large number of rules, and you have all of these feedback loops that allow you to constantly curate up the quality of your network. And so, a couple of examples of how that works. So we've built this very sophisticated rules engine that has allowed us to ingest the tens of thousands of unique rules that every health system, every job, every state, whatever requires for a particular position, and ensuring that we understand the unique nuances between every job. We built a system and a schema that allows us to handle all of that. And we also programmatically collect all of the evidence to ensure that the clinicians meet those rules, and then have built the technology to evaluate those rules against those credentials, that evidence. And so that means that we can always ensure that a person is a 100% qualified match for a particular position. And then the wraparound of that is, of course, that we have a lot of checks and balances. Most notably, we do a lot of surveying on assignment and post assignment. So we get nurse managers and allied health professional managers to evaluate the clinicians that we send them on a variety of professional and clinical skills. We do skills assessments on an ongoing basis through standardized exams. And then we have a robust clinical excellence team staffed by actual clinicians who help set the rules, but also help coach people when they are falling short of certain expectations. So it is a belt and suspenders approach. But like I said, we care about this a ton because ultimately quality is, high quality is the one thing that can, consistent high quality is the one thing that can build trust, which is a truly necessary component to a successful marketplace.
And what's next, Alexi, for the company that's really exciting you? What's coming up that you can share with us here today?
For us, we're just really excited to continue to grow, to continue to get more people to understand the value that we offer. We have grown a lot, but we're still, small fraction of the entire opportunity, entire market. So there are still tens of thousands of clinicians who haven't worked with us, and then thousands and thousands of facilities that haven't worked with us. So we'd really like to get them all onto the platform. I think we've got the goods, and now the question is, how do we tell everybody we've got the better quality, better service, better price, and so that's our big focus is on expanding our footprint and helping to transform healthcare staffing, improve efficiency, and reduce cost. And so that's really what we're focused on.
Well, I'm really excited to continue the conversation with you. Hopefully, we can have you come back in the near future. We can dive more into things, but really appreciate you coming on the show here today.
It was my pleasure. I'd love to have another slice. So I'll talk to you again soon, but thank you for inviting me today.